COVID-19, perhaps more than any other health emergency, has brought forth overwhelming challenges and taught us a lot of lessons we must take into account. Not only to public health, but the COVID-19 pandemic has brought profound implications in our food system, economic progress, employment, and conventional schooling. To effectively mitigate the impacts of COVID-19, our country is urged to adapt to the crisis by developing and implementing action plans together as one community. Here's how several LGUs fortify their communities in the time of COVID-19. Let's start with Cagayan de Oro City. The atmosphere of uncertainty was what made the early days of the pandemic difficult, and reports of an unknown virus spreading from one country to another had left citizens and governments worried for public safety. In what seemed like total darkness for Cagayan de Oro City Mayor Oscar Oca Moreno, the city government's immediate response was to put public health at the forefront and ensure that the local health system is well supported. In an attempt to keep the community safe, the Cagayan de Oro City Mayor identified the need to strengthen the capacity of the local health system and take on an aggressive approach on tracing, isolating, and treating COVID-19 cases. After announcing the first confirmed COVID-19 case in the country, the City Health Office or CHOs immediately formed a COVID-19 task force and coordinated with the local branch of the Department of Interior and Local Government to activate the Barangay Health Emergency Response Teams. The task force led the orientation and training in Infection Prevention and Control or IPC for the first roster of healthcare workers in the CHO and barangay health centers, as well as for restaurant employees and accommodation businesses. While training is ongoing, the CHO and barangay captains established an intensive surveillance mechanism through the birds for early detection and assessment of the virus. In that regard, the city government took the initiative to purchase their own RT-PCR machines, which the CHO handed over to Northern Mindanao Medical Center. The DOH retained Apex Hospital in their area. Now, with testing readily available, they were now able to identify confirmed COVID-19 patients and administer appropriate action for isolation and treatment. To ensure continuity of care, the City Health Office assigned step-down facilities such as CIUs and TTMFs to handle the isolation and mild cases, while the Northern Mindanao Medical Center is focused on treating severe COVID-19 patients. Moving into the new normal, the fight against the virus is often seen as a trade-off between public health and local economy. But for Mayor Moreno, these two need not to be mutually exclusive and must be able to go hand in hand, while stressing the importance of public health as it cannot be sacrificed in favor of the economy. Another city that showed exemplary pandemic response is Iloilo City. What was once a thriving, bustling city turned silent when the pandemic hit. And on top of the fight against the pandemic, local communities had to grapple with food security and employability, especially since many jobs were lost and living expenses were starting to mount. Food security for their constituents is the LGU's main challenge in this pandemic. With households, health workers, and non-pandemic frontliners to feed, the city governments leveraged the Ilonggo Solid Community spirit to address the basic needs of the community. To address food security, Mayor Jerry P. Treñas ensured that there was sufficient food for all while people were in quarantine. And to aid this goal, the city government established 240 community kitchens situated within the barangays to provide lunch and dinner for the people. Along with this, food necessities such as grocery packs and rice were handed out to encourage the people to stay at home, while the local health sector was keeping the virus under control. Soon afterwards, private companies started collaborating with the city government to support this endeavor. Ilonggo bakeries and milling companies soon offered their supplies and manpower to support the community's poorest sectors. As with any LGU, Iloilo City had to do budget acrobatics to support their pandemic expenses. Their expenses showed that a large portion of the health budget was allocated for the establishment of a permanent laboratory and the hiring of health workers. The budget was also spent on transportation vehicles for COVID-19 patients and close contacts. And lastly, we have Marikina City. Marikina City's disaster management and response has been proven to be effective not only once, but for the many times the city faced natural calamities. Lately, a pandemic has tested yet again the city's capacity to handle a crisis. And for Mayor Marcelino Marcy Teodoro, there was an inherent value in listening to the people's needs at the time and converting those insights into mechanisms and systems that would protect them and encourage stronger coordination among national and local leaders. Knowing that mass testing was essential to curb the spread of the virus, Mayor Marcy Teodoro mobilized resources to build their own molecular laboratories, though this did not happen without a fair number of roadblocks. According to Mayor Marcy Teodoro, the most challenging part was when they established their COVID-19 testing laboratory, which was initially rejected by the DOH. As this type of testing laboratory is new to the community, resource mobilization and operations became challenging. Soon enough, they were able to fully establish the laboratory as well as a targeted system for vulnerable people. To accelerate a safe and effective vaccination process, the city of Marikina opened the Mega Vaccination Center at the Marikina Sports Complex. This facility is capable of vaccinating 80 to 100 individuals daily. An infirmary is also provided to monitor vaccinated individuals to make sure they won't have any immediate reactions. And in the event of life-threatening reactions to the vaccine, ambulances and emergency respondents are on standby to provide appropriate medical treatment. The whole country is united by the challenges caused by the pandemic, and for Mayor Teodoro, local and national governments should work hand in hand not only with regard to data sharing but also in establishing a comprehensive surveillance network and system.